Mr. President, we solicited questions from the public to direct to you and had a Facebook audience vote on which one they wanted to be asked. And the winner was a fellow named Ken Fletcher of Albany, Oregon. And his question is, why is there so much focus on reducing entitlement programs as opposed to the military or other forms of spending?
Well, for the same reason Willie Sutton robbed banks. That's where the money is. But I think you do have a point. Let's talk about it. Non-defense discretionary spending is only about 13% of the budget. And there are savings to be had there. The GAO just did a big study, which I'm sure a lot of you have seen, which determines, for example, all the different programs. I think there are like 19 different adult literacy programs. That's just a small example. But there's a few $1 billion there. It's not a significant amount as against the size of this deficit, but it is a significant amount in terms of reinvestment in our future. I personally, if it were me, I personally would favor looking at that study, implementing all the things as we did under Al Gore's Reinventing Government plan, which saved $136 billion over a 10-year period. And I'd like to see that money reinvested in non-defense discretionary spending that's future-oriented, in green technologies and bringing back manufacturing and biotechnology and a reauthorization and expansion of the new market initiatives, which rewards investments in relatively poor areas in America. That's what I think should be done there. There is money there, but it's not dramatic. Then on defense, I agree with you, sir, but defense is 4% of our gross domestic product. Medical spending is 17.2%, and almost half of that is government insurance of some kind or another. So there's just a lot more money in health care. Also, on Social Security, it was meant to be self-sustaining, and with the retirement of the baby boomers, it won't be anymore. But I think there are progressive and fair and decent ways to reform Social Security, and I think Medicare and Medicaid cannot produce savings in good conscience unless they're part of a comprehensive plan to bring down the rate of inflation in medical costs. You simply can't have medical costs going up at 3 times the rate of inflation every year. And you can't justify America spending 17.2%, Canada being the next highest rich country at 10.5%, Germany and France always ranked first and second for overall outcomes at 10%, and America ranking somewhere in the high 20s to 30 in the overall effectiveness of our health system. Everybody just assumes we can't do anything about this. But if you break down where we're out of whack with the rest of the world, you see that the biggest category is rooted in paying for procedure instead of for health care, and having no comparative studies of cost and outcomes. Pennsylvania, I think, is still the only state in the country that requires all the hospitals to file what are charged for various procedures and attempts to determine the comparative results. And what they find every year is there's literally no connection between what's charged and what results are getting.